Today, we are going to learn the first part of the prescription chapter, where we are going to see the definition of prescription and its parts in detail. Let's see the definition. It is a written order from a registered medical practitioner or other licensed practitioner such as a dentist or veterinarian to a pharmacist to compound and dispense a specific medication for the patient. In pictorial form, it is a written order from a physician, veterinarian or dentist to a pharmacist to compound means to prepare and to dispense means to supply a specific medication for the patient. Typical prescription consists of following parts. First, date. Second, information of patient. Third, superscription. Fourth, inscription. Fifth, subscription. Sixth, signatura. Eighth, renewal instructions. And final, signature and registration of the physician. We will see these parts one by one. First point is date, and the second is name, age, sex and address of the patient. Due to the date on prescription, pharmacist finds out the date of prescribing and the date of presentation of it for filling. A prescription containing narcotic or other habit-forming drugs must bear the date in order to avoid its misuse if it is presented number of times by the patient for dispensing. The second part, information of the patient, serves as the identification of the prescription. If the information is missing, the same should be included by the pharmacist after proper inquiry from the patient. Age and sex of the patient help the pharmacist to check the prescribed dose of the medication. Next part is the superscription, which is nothing but the RX symbol written before writing the prescription. It is an abbreviation of the Latin word receipt, means you take. In olden days, this symbol was considered to be originated from the sign of Jupiter, the god of healing, and was employed by the ancient in requesting the god for speedy recovery of the patient. Next is inscription. It is the main part of the prescription order which contains the names and quantities of the prescribed ingredients. The names of ingredients are written in English language, and some common abbreviations can be written in English and Latin languages. Inscription contains following parts. In base, the active medicaments which are intended to produce the therapeutic effect are written. These are drugs. Next part is the adjuvant, where the substance written over there enhances the action of medicament or improves the palatability of the preparation. We also call these excipients or additives. Third part is the vehicle, which is either solid or liquid. It is mentioned either to dissolve the solid ingredients or to increase the volume of the preparation. Next part is the subscription. It is nothing but the directions to the pharmacist for preparing the formulation and number of doses to be dispensed. Next part is the signatura. It is usually written as SIG on the prescription. It consists of the directions to be given to the patients regarding the administration of formulation. Pharmacist needs to transfer these instructions on the label of the container in which formulation is dispensed so that the patient can follow it. These instructions may include the quantity to be taken or the amount to be used, the frequency and timing of the administration or application, the route of administration, or any special instructions regarding the dilution. The second last part of the prescription is renewal instructions. The prescriber indicates on every prescription order whether it may be renewed and if so, how many times. This is very important, particularly in the prescription containing habit-forming drugs to prevent its misuse. Last part is the signature and registration of the prescriber, where every prescription must bear the signature, registration number and address of the prescriber.